The opioid epidemic has heightened public awareness surrounding the risks and side effects of opioid pain medications, especially for young people. As an orthopedic surgeon specializing in sports medicine, I am passionate about educating people that opioids should not be the first line of defense when it comes to treating pain for youth athletes, especially after surgery. Studies have demonstrated that the risks and complications of many opioid-based pain management approaches may be magnified in children. In fact, the unwanted side effects from these medications, including nausea, confusion, constipation, dizziness, can actually impede post-surgical recovery and make it more difficult for young patients to get back to their active lifestyles, let alone playing competitive sports. Young athletes, especially those at the high school and collegiate levels, are oftentimes under tremendous pressure to play and perform at the highest levels of their sport. This pressure, coupled with a mentality to get back to playing no matter the cost, can have dangerous mental health implications ranging from anxiety, depression, isolation, and even a feeling of loss of identity when a player is sidelined with an injury or surgery. The worst thing we can do for these young players who are struggling to cope with being on the bench, should they be injured, is to prescribe large quantities of opioid medication and send them on their way. This risky combination has the potential to be the trigger for a lifetime of struggle with opioid dependence or addiction. In the case of surgery, specifically, data demonstrates that nearly 1 in 10 patients prescribed opioids to manage post-surgical pain go on to long-term use, meaning that they're still taking opioids 3 to 6 months after their procedure. For an athlete, this is completely unacceptable. They need to be training and returning back to the field. If I explain to the youth athlete why we want to avoid opiate medications because of the side effects, because of the risk of misuse, and then set expectations, tell them I don't want them to take it and they don't need to take it, a little bit of pain is okay, then I believe we're setting the table to allow them to recover from their surgery in a more effective way. By prioritizing non-opioid options, we can help to ensure the well-being of our young athletes both on and off the field. I use a multimodal approach to pain management that consists of a range of different non-opioid options to achieve sufficient pain control. Specifically, I use a long-acting local anesthetic called Exparel. Exparel is injected during your procedure directly into the surgical site to help manage pain for the first few days after surgery. This has allowed me to minimize and in some cases eliminate the use of opioids to manage my patients' pain after surgery while also allowing for an overall enhanced recovery experience for my student and collegiate athletes. Exparel has fundamentally changed how we do this. I don't need to use opiate medications. The athletes don't depend on it. My goal is to empower patients and their parents to request non-opioid options as the standard of care to manage pain after surgery. Youth athletes have options when it comes to how their pain is managed after surgery. If your provider isn't offering a non-opioid approach, you should feel empowered to find a doctor who will offer this.